joining us, this is still Good Morning Abuja on NTA Channel 5 Abuja. I have in the studio with me Dr. Enema Amodu, who is the chairman, Nigerian Medical Association, FCT. You're welcome to the program, sir.
Thank you very much.
And a happy New Year to you.
Happy New Year to you too.
And I'd like to start the program by thanking you, because healthcare workers you're our heroes. So thank you so much. Thank you for coming today.
We don't feel like heroes, but thank you and safe.
So, sir, the second wave of COVID-19.
Yeah.
COVID-19, I mean, we're in the new year, but we're still talking about COVID-19 because it has affected us in so many ways, and we're still finding out the ways that it's still affecting us. And, we've been talking about the protocols, how to follow them, wear your mask, social distance, wash your hands, try as much as possible to stop the spread of COVID-19. But it's been difficult talking to people and telling them this is why it's important. Some people believe, other people have their doubts, but the healthcare workers are working behind the scenes, morning, afternoon, night, 24/7, giving their all.
Yeah.
So the implications of not following these protocols and the guidelines, how is it affecting you, the people behind the scenes?
Good morning and Happy New Year once again. Thank you very much for having me. Well, the implication means that we are more exposed, as it were. Of course, the whole of 2020 from inception has been a year riddled with COVID-19 pandemic. And initially when it all started out, the lockdown were imposed, restrictions, in social gatherings and all that were imposed. But gradually over time, because of economic crunches and all that, government had to ease off the lockdown, allow people to go back to their work and all that, but with strict guidelines, maintaining the non-pharmaceutical safety protocols. But as it were, it just means that a lot of people just went back to the old ways. Driving to the studios this morning, I observed a couple of taxis, 2 persons in the front seat with a driver.
Wow.
That makes 3. And none of them were wearing masks.
Wow.
And nobody was there to ensure that.
Yeah.
Earlier in the week, I was in Kaduna, and I think it was on Monday morning, precisely. That's the day of the public holiday. I was in Kaduna, and at one junction, I don't know Kaduna very well, but at one junction, there was a terrible holdup. And what was the grouse? There was a joint task force of policemen, civil defense, army.
Yeah.
So saw them carrying guns, and they were enforcing everybody to wear face masks, and those not wearing face masks were being fined 5,000 naira.
Wow.
They were so stringent that even people alone on bikes were wearing face masks. But maybe it's because Governor El-Rufai came down with it, so you understood the gravity and the implication of all that. So, but for us here in FCT, initially when the lockdown was imposed and the restriction, we did that.
Yes.
People were wearing masks, people were carrying their masks, But as it were now, people don't, you see people in public transport, in public spaces, they're not wearing masks. So I think we should step up and because, like you rightly said, we are the ones at the receiving end. People will still come to the hospital, and we're still bound by oath to attend to them. Despite all the inconveniences and then all our, emoluments not being properly, measured out to compare with the degree of risk that we are exposed to. But despite that, we're still and patients come. And then, like I said earlier before in some of my press interactions, I contracted it. The patient came to me, sat in my clinic, and she was having nose bleeding. I'm an ENT surgeon.
Oh, wow.
She had epistaxis, nose bleeding. And then as I was asking her questions, she also showed me a result she got on her phone that she's COVID negative, because that was the next thing I was going to ask her to do. So that gave me confidence, despite the mask I was wearing. And I examined her. Only for her, I now sent her for a CT scan and investigation we usually do for such conditions. And by the next week, I found out that she now came down with severe fever and catarrh and cough. So the hospital where I saw her wanted to now do COVID tests, and they just wanted to inform me. And at that time, I had been exposed to her a week earlier, and I'd even came down with symptoms. Recognizing the symptoms, whilst my sample was taken and I was waiting for the results to come out, I started treatment. So by the time I heard that she was now having frank COVID symptoms, I'd almost completed my own course of treatment. Yes. And that was when she was now being diagnosed. So when I saw her the first time, she was positive with a false negative result.
Wow.
And I was, exposed to it. So there are a whole lot of things we need to do in FCT, There are a whole lot of collaboration we need to do with the government. NCDC, I understand, are doing their best. They're supposed to be in the forefront of these preventive measures of this pandemic and other epidemics. But as it were, realistically, they could be overwhelmed and they need support. They need help from the federal government. And one of the ways is when patients go to do tests, let it be a standard lab, first of all, with all the experts in place. So that when a result is issued out, you can take it to the bank and not expose other health workers inadvertently when they try to help the patient. Do you understand? So from that level, then we as a government, as Enema, we are doing our work. We've sworn the oath to work, And it's so when patients get the correct results, when they come to the hospital, then we can now have confidence. If you are positive, we'll know how to deal with that. And dealing with that also requires government playing their role, our employers playing their role, providing us with the basic PPEs, face mask, hand sanitizers, the full regalia sometimes, as the case may be. So if those things are available, if you're positive, we know how to prepare before we attend to you. If you're negative, then we'll believe the result is negative and we'll treat you with some sparing degree of protection.
So because of the issue with the woman with the false negative, and I know that maybe sometimes we don't know how to find that information. For instance, if you feel ill and you want to go ahead and look for areas that you can have the test done, where are some of those locations that you think are 100%?
I can't tell you where it's 100%, as it were, because before COVID, we've had issues of false negative and then some extremes false positives. All we're just saying as NMA is that such labs that right now are saddled with the responsibility of running the test should ensure the proper guidelines, to ensure that experts take the samples, experts run the test. And when we mean experts, we hope that pathologists will be involved as well, because they are the ones that know how to do the reading of the virus. They know how it's done. One of our pathologists I was having a discussion with told me about what they call cycle threshold, which is a way they map the virus and read it. So all those technicalities, I'm an ENT surgeon. He just mentioned it to me a few days back and I've forgotten already. So that means there are people that know how to interpret. No, first they know how to even take the samples, know where to go take it from the biology of the virus. You know where it likes staying. That's why you see them. They don't take urine samples or maybe
it
has to be from the back of the nose, what we call the nasopharynx, or the back of the mouth, which is the oropharynx. Those are specific areas where the virus likes staying. So when you go take samples from there, also ensure when you stain it and you do all the things they do in the lab, ensure that the strict methods, procedures are followed. That's the only way you can ensure that you get the correct result.
Okay, sir. So I'd like to know, for instance, a person is not feeling well and they decide, okay, maybe I should run a COVID test, and then you go and they send you your results and it's negative, but you're still not feeling well. So and usually they say you should be in isolation for 14 days. But of course, maybe you're working and you say, oh, I took a test and it's negative. But so how long should you at least isolate yourself to be sure that even if your test is negative, that you're not trying as much as possible to pass across the COVID?
Well, it's simple. Before COVID, for us clinicians, we usually treat the symptoms and the signs more than the results. Because the results or the tests could be subject to a lot of interpretations and possibly errors. So you're sitting there, you're having headache, you're having fever, you're coughing and having catarrh, you're breathless,
Yes.
and your COVID-19 test says it's negative.
Yes.
I'm going to treat the symptoms I see.
Yes.
And for anybody that wants to stay healthy at that time should ensure that you comply with the safety. So isolate yourself. You're ill. Even if it's not COVID, if you're ill and you know you're ill, you can't walk.
Yes.
So take excuse duty, isolate yourself and start your medication.
Okay.
Like I said, I started the medication even before the results came out. And I started feeling better.
Yes.
Because sometimes some of these results, they take time to come, maybe 24 hours, 48 hours for those that are fast.
Yes.
Some have even taken as much as 2 weeks.
Okay.
Not to indict anybody, but this is the reality.
Well, thank you very much for coming on the program. And really, still, we have to say thank you to you. Thank you so much for putting your patients first. Thank you for coming on Good Morning Abuja.
Thank you very much, Maimuna. Happy New Year.
Same to you, sir. So we've been speaking with Dr. Enema Amodu, and I'm sure that you've heard all he has had to say. We have to take better care of ourselves, and please, 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 please follow the guidelines, because we don't only affect ourselves and our family and friends, but also the healthcare workers that are doing the very, very best that they can. So please, let's follow the NCDC guidelines.